In Woodland, California, you are on the air with Representative Pocan.
Yeah, I'm just calling about this DCE thing that's being used to decimate Medicare, and I'm just wondering, is Congress going to do anything to roll it back, to get rid of it, to preserve Medicare, and also if you can reverse what it's done so far, in other words, reinstate people who have been kicked off of Medicare with this? Thank you.
Yeah, and I believe, Tom, this is the issue, right, that we talked about last time a little bit. So
direct contact tracking entities.
So let me give this update. I believe the Biden administration canceled 2 of the 3, I don't know if the word experiments is the right way to go, but practices of this, firms that were doing this, but they still have one, and I don't fully understand that. That's why we did a letter. And I apologize because I'm at home. I don't have all my normal papers in front of me, Tom. But I know Katie Porter, myself, and 2 others initiated that months ago to Congress, to the White House to ask why we were still doing this. But 2 of the 3 they did eliminate. But there's still this last one that's out there that is much like the model I think that you and I have talked many times about around Medicare Advantage, which. By the way, Tom, I don't know if this may not be the best place to do it, but Lloyd Doggett from Texas is an expert on this, and I talked to him about he would love to come on your show sometime and talk about this subject with you, because cool. I've been reading your book, your most recent book on healthcare, and I mentioned to Lloyd about the chapter on it. We had a nice conversation on the floor of Congress about it, and I think he would be a great guest. But all the problems that you have identified in that book and on the radio about Medicare Advantage, this is kind of practicing some of those models, and that's why we weren't wild about it, because it takes us away from the traditional Medicare option. But there's still one remaining, and I can't say why that. We haven't gotten the answer back on that portion, but 2 of the 3 that were out there have been eliminated.
I'm still learning about this. We had the former president of Physicians for National Health Program on the program for a half-hour deep dive into this day before yesterday. And she said that the way this all happened was in the original Obamacare legislation, the Affordable Care Act. There's a little provision that says that Medicare can experiment with new ways to use the free market to lower costs. And this whole direct contracting entity thing, where your doctor or your hospital can be paid directly by Medicare and create their own little network and basically remove you from Medicare and drop you into this system without even telling you. This is one of 50 some odd experiments that the Center for Medicare Services started. And this one now has, it's enrolled fewer than 1 million people, but they are thinking that they can enroll all 30 some odd million people who are on traditional Medicare within the next year or 2, and just end Medicare altogether. And it has nothing to do with Congress. This was passed as part of the Affordable Care Act, and so it's entirely in the purview of the Center for Medicare and Medicaid Services. And I don't recall if the director of that, I know the director of that and the director of Social Security were both Trump holdovers, and there was talk about getting rid of them. I don't know if that has changed, but it seems like that's the point of pressure is the Center for Medicare Services. Just FYI, that's what I know so far.
Yeah, and I believe Lloyd Doggett actually has a bill addressing all this. So I really think have Lloyd on, because I know that your listeners are interested on this. He absolutely is an expert on this, serving long-term on Ways and Means. But there's a good article in Intercept in the last week on this as well.
Yeah, okay. We'll check it out.